Hello everyone. Right, last night this came out of Embargo, this new Nursing and Midwifery Council report, and we're going to go through it because it shows that in terms of EU nurses, their decline continues from last time. So you may remember the report from September 2017 that first showed that dramatic trend kicking in. This trend is increasing. So we're going to talk about the big picture. The big picture is that even though we've got 40,000 nursing vacancies, we have 495 fewer nurses than at the end of March 2017. Now, if you look at the graph there, you will see that even though you get slight increase from UK nurses and non-EU nurses, the decline in EU nurses, the decline in their numbers outweighs that. And this is remarkable to see a decrease in EEA nurses by nearly 3,000 here, because for years they were increasing year on year by numbers like about 6,000 or 7,500. In fact, as I've said before, from 2013 to 2016, EU nurses were providing all of the growth in NHS nurses because UK and non-EU nurses were kind of treading water, but all of the growth was coming from EU nurses. Now they are in decline, and in decline at a greater rate than we can get nurses from elsewhere. So that means that we are, as they say here, still 4,266 fewer nurses than the peak of March 2016, just before Brexit. Okay, that's where we're at. And so the drop-off in nurses from the EU has continued, both in terms of an accelerated leaving rate and also flatlining nurses coming in. So if we look at the report from last year, just to show you how trends have continued, this was the graph that sort of got a lot of people's attention. This is EU nurses coming in, and of course that was combined Brexit and the new English language test. But nurses already here didn't have to do the English language test. So if you're looking at the nurses already here leaving, you see that top line, that kick up, that's the EU nurses in response to Brexit. So they already have a fairly high turnover rate for leaving because they're neighbouring countries. They usually come here and train and transfer skills. But from Brexit, that rate kicked up. Now, if you look at the, I've marked this all up. If you look at this year, how this continued, you see that drop. It's now, woomph, it's now dropped even further. The numbers aren't quite the same from the previous report because they've shifted the yearly frame by 6 months. But you can see that trend of, you know, it had been rising and then dropped and now really dropped in terms of this is the number joining the register. So that's really flatlined, as it were. And in terms of those EU nurses that were here and on the register, you can see that kick up in leaving has now continued. So this is now going at an increasing rate. Now, they did actually, in this one, which is more advanced than the last one, ask the nurses who were leaving why they were leaving, and they didn't get responses from everyone, but those who they did get responses from, 46.7% of the EU nurses said that Brexit was one of their top 3 factors. So if you consider, like I said before, that EU nurses have quite a high turnover, they tend to be young and highly mobile, certainly younger than our UK nurses. So they're moving around all the time. So you would expect a certain proportion to be leaving just because they're leaving. But nearly half of them are saying that Brexit is a major factor in this. And that's explaining these quite dramatic trends that we are now seeing. So that came through last night. I will integrate numbers from these 2 reports and look into it further because they have different time frames, September to September for the last one, March to March for this one, so we can look at that in more detail. But last night I was also going through this, and that's the House of Commons report on health and social care, about what Brexit means for medicines, medical devices and substances of human origin. And basically, it's another big tome that says Brexit screws it. So there can be no doubt now that Brexit is hurting our NHS. It is hurting our NHS staffing. It is hurting our NHS finances. Just the fall in pound increases our costs in terms of whether we're covering costs for people in other countries or whether we're buying devices and drugs from other countries for the NHS. And it's also damaging our frameworks of collaboration for research, for our pharmaceutical companies, some of which have spent many millions preparing for no-deal Brexit and hard Brexit. And it's destroying our frameworks for studying rare diseases and clinical trials and so forth and so on. So I will wrap it up there, but the big news today is, and this is out through the papers, that Brexit is absolutely hurting our EU staffing levels. And the important thing here is, when you've got 40,000 vacancies and you've got the EU nurses that were the driving force behind plugging those vacancies, when that goes into reverse, the overall trend goes into reverse, and that strain means that other nurses are then more likely to leave, because nursing strain and staffing strain is one of the reasons that other nurses in the UK or from elsewhere will leave as well. So it's a really dangerous cocktail.